Supporting the psychological health of probation staff during and after COVID-19. The way in which we work has changed. Instead of being in busy offices and in regular contact with co-workers, supervisors and friends, many of us are working remotely or at a physical distance from other people. It's unclear exactly what sort of impact these new ways of working will have on us or on our service users, but there is research that we can draw on to help us understand some of those things that could help to protect our psychological well-being during these changing times. Studies suggest that high job demands and low level of control over our workload or working conditions can result in a high level of strain. Strain is a negative reaction to stressors. In the short term, strain is characterised by poor mood, and in the longer term can lead to burnout and health complaints. Recovery is the opposite of strain. Recovery results in replenished energy and more positive emotional experiences, as well as a reduction in the physiological indicators of strain, such as increased heart rate and blood pressure. The activities that help someone to recover differ from person to person, but the experiences that characterise recovery are the same and are made up of detachment, relaxation, feeling skilled or competent, and having a sense of control over your work. Psychological detachment is characterised by a lack of negative job-related thoughts during non-work time. It can take the form of rumination, worry, and repetitive thought, viewing job demands as threatening or harmful, rather than a complete absence during your own time of work-related thoughts. It's important to note that being able to detach from work doesn't mean we're not motivated or committed to doing a good job. It doesn't mean we don't care. Rather, being able to detach helps us to recover and to have the resources and energy to do our work more effectively. What's effective in helping us recover? Research suggests that there are a number of things we can do to encourage recovery from work and to protect our own and our staff members' psychological health. As an organisation, leaders and managers can do what they can to keep the job manageable by minimising the degree to which people are expected to operate under high job demands, to reduce emotional stress through organisational routines which are fair and feel procedurally just, by providing structures and clear rules about how to satisfy expectations of a role, making sure staff members know what's expected of them, how to achieve this and by when, and by limiting working hours, especially overtime, so that these are not excessive, leaving time for non-work activities. Supervisors can play an important role in creating conditions under which people are more likely to detach from work, by enabling some flexibility in working and avoiding asking people to think about work-related tasks in non-work time, such as over the weekend or overnight. Managers can encourage and create opportunities for control over work, enabling people to have some say in when they work, how they manage their workday, including when they take breaks, in accessing the resources required to do the job, and in arranging their working environment. This may be even more important in the current context of imposed restrictions which limit control, or at least choice, over non-work activities, including socialising. Leaders and managers can promote boundary management by developing and communicating a clear and transparent policy regarding the expectations on availability and work during non-work time, and they can consistently model these boundaries. Managers can promote workplace social support, promoting and providing opportunities for support from co-workers, supervisors, or the wider organisation. How supported people feel by their organisation matters, so staff should be aware of the range of services that are available to them. In particular, as teams are more isolated and opportunities for more informal support have been reduced, it could help to encourage co-worker-led support systems and to share local learning about diverse and effective ways of doing this. There is some evidence that debriefing and emotional offloading can protect against vicarious traumatisation the experience of trauma or stress as a result of working with victims of trauma, or exposure to details of others' traumatic experiences. So, we can protect time and space and create opportunities for these conversations. Some research suggests that compassion satisfaction, the satisfaction that results from being able to help others, can protect against or mitigate secondary traumatic stress. This suggests that encouraging supervisors, co-workers and staff themselves to spend some time reflecting on and acknowledging the good that they're doing for others could help protect against or at least reduce the psychological impact of the increased stressors they may be facing. In the context of the COVID-19 pandemic, when there may be restrictions on the practical help staff can offer service users, it could be important to emphasise the value of the emotional and social support staff provide. Managers and leaders can let staff know that their health and well-being is a priority. While high-quality relationships with supervisors have many benefits for staff, these can lead people to feel responsible for maintaining a high level of performance and involvement in work, which can get in the way of recovery. Leaders and managers can emphasise the importance of support, health and well-being by promoting organisational well-being interventions, including mindfulness and relaxation, which can aid detachment. And what can we do for ourselves? Being involved in work-related tasks during non-work hours gets in the way of psychological detachment. We can all take steps to detach ourselves from work each evening by signalling the end of the workday with a non-work-related activity and by spending time with others that you don't associate with work. This can reduce the number of contextual cues outside of work that may prime you to think about work and which can get in the way of full psychological detachment. Physical and social activities can be effective for moving away from work-related thoughts and feelings, like going for a walk, doing a workout, or calling a friend. Making work plans for the next day is another promising method for achieving detachment for people with high workloads. More specifically, plans that specify when, where, and how the goal will be achieved are more successful. So finish each day by making a list of outstanding tasks. Put them in order of priority and make a plan for the next day, indicating where, when, and how you will complete those that are most important. Try to avoid excessive working hours, limit overtime, and if possible, stick to a routine and protect time for non-work related activities. To encourage relaxation, try stress management programs, relaxation, mindfulness, and cognitive behavioural techniques, sleep training, or take part in a lifestyle change program, exercise, or well-being interventions. To build confidence in your competence and skills, take advantage of training and development opportunities. Make a plan for what you want to work on and how, and share it with your manager. Finally, we can make sure we tailor support to need. Some people may need more support. We should pay particular attention to ensuring that support is available to those with pre-existing experience of trauma and/or who are experiencing potentially traumatic events as a result of the current crisis. People who are new to the job, such as trainees or newly qualified probation officers, who may not have yet developed some of the coping strategies and formal and informal support networks that may protect more experienced staff. Those with particularly high workloads, especially people with a high volume of cases who have trauma symptoms or a history of trauma. People who tend to overwork, who may therefore have more trouble detaching from work. Probation work is challenging, but it can be hugely rewarding too. There are many ways in which we can help to protect ourselves and our staff. Click on the links below this video to access a range of support services and evidence-based resources on the strategies that we've covered. Thank you for listening.